What if I told you that strokes are no longer just a problem for the elderly? What if I said that in the past decade, the number of strokes in people under 45 has surged, up by nearly 15% in the United States alone? That's not speculation. It's what the CDC is reporting today. Now imagine this, a 24-year-old man, full of life, with plans, dreams, and a family that loved him. One morning without warning, he collapsed. The doctors found not one, but two massive brain bleeds. His family didn't even get time to say goodbye. That young man's name was Joshua, and on May 25th, just months ago, a stroke took him from this world. You see, we often picture strokes happening to someone older, someone frail, maybe someone already in poor health. But that image is dangerously outdated. More and more, strokes are striking down people in their 20s, 30s, and 40s. Mothers, workers, athletes, even teenagers. Why is this happening? Why are these life-altering events reaching into younger generations? And most importantly, what can we do to stop it? Because here's the truth. A stroke doesn't care how old you are. It doesn't wait until you retire. It can hit anyone, anywhere, at any moment. And the worst part, many people ignore the warning signs or don't even recognize them when they come. But what if we could change that? What if you knew what to look for before it was too late? That's what this video is about, because the more you know, the faster you can act. And when it comes to stroke, acting fast can mean the difference between walking out of the hospital or never walking again. So stay with me. I'm about to show you how to recognize the signs, how to respond, and how to protect yourself and your loved ones. Because stroke is not just a possibility. For too many families, it's already reality. In just a moment, I'm going to share 3 true stories. They're not taken from a textbook. They're real, and I believe you won't forget them. Each one begins like an ordinary day, nothing unusual. A mother rocking her newborn, a man working late at his computer, a woman laughing at a family gathering, and yet within minutes their lives change completely. Different people, different lives, but they all had something in common. And if you pay close attention, you'll see the warning signs before they even knew what was happening. Let's take a closer look. Case 1. Jessica was 32 years old. Just 4 days after giving birth to her baby girl, she was sitting quietly in a chair, feeding her child, when something felt off. At first it was dizziness, subtle but strange. Then when she tried to stand, her legs simply wouldn't respond. They felt like rubber. She called out to her husband, but her words came out slurred, barely understandable. In less than 10 minutes, he had her in the car and on the way to the nearest emergency room. The doctors ran a CT scan, confirmed the diagnosis, and immediately administered clot-busting medication. What happened next seemed almost unbelievable. Within minutes, her speech returned. The strength in her legs came back, and her dizziness disappeared. Jessica had suffered an ischemic stroke, and thanks to her husband's quick thinking and access to modern treatment, she walked out of the hospital days later. Had they waited even another hour, the outcome could have been tragic. Case 2. Hugo, a 62-year-old lawyer, had been running himself into the ground. Stressed by debt, overworking, skipping meals, sleeping poorly. He was overweight, diabetic, had high blood pressure, all poorly managed. That night around 2 a.m., as he worked under a desk lamp, he felt an explosive pain behind his eyes. A headache so sudden and severe, he knew something was terribly wrong. He called his sister, a nurse, but before she could answer, he collapsed. 10 days later, he woke up in the ICU, confused, weak, and surrounded by machines. He had undergone emergency brain surgery to relieve pressure from a hemorrhagic stroke. Doctors kept him in a medically induced coma for days to save his life. When I say time is brain, Hugo's case shows what happens when that time slips away. His recovery was long. Some of his abilities never fully returned. But his story is also a warning. These conditions, diabetes, high blood pressure, stress, they don't just add up, they explode. Case 3, Regina, 58 years old, was enjoying a family party, laughing, chatting, holding a glass of wine, when her daughter noticed something wasn't right. "Mom," she said, "your smile looks funny." Regina felt a tingling in her cheek. She looked in a mirror and saw that the corner of her mouth was drooping. Before she could even panic, the symptoms began to fade. The tingling stopped. Her face returned to normal. But her daughter didn't wait. She drove her straight to the hospital. An MRI revealed she had suffered a TIA, a transient ischemic attack, often called a mini-stroke. The good news? It didn't leave permanent damage. But the bad news is that TIAs are serious warnings, like sparks before a fire. Doctors admitted her for observation and started her on a plan to prevent a future, larger stroke. 3 people, different stories, different symptoms, but they were all strokes, and in every case, timing was everything. So now let me ask you, if it happened to someone you love, would you know what to do? All 3 stories had one thing in common: a stroke. And here's what you need to understand. None of them saw it coming. Not Jessica, not Hugo, not Regina. Strokes don't wait for convenience. They don't make an announcement. They strike fast and they strike hard. And the scariest part? So many people lose precious time because they wait. They think the symptoms will go away. They convince themselves it's nothing. But every minute lost is brain tissue gone. Memory, movement, speech, vanishing in real time. That's why I need you to really hear this. Knowing the signs and acting fast can mean the difference between life and death, or between full recovery and lifelong disability. This next part may save someone's life, maybe even yours. There's a phrase we use in medicine that carries enormous weight: time is brain. And it's not just a slogan, it's a biological fact. The brain depends on a constant flow of blood to deliver oxygen and nutrients. When a stroke happens, that blood flow is blocked or interrupted, and without it, brain cells begin to die. Nearly 2 million neurons every minute. 2 million. Think about that. That's the equivalent of years of memories, motor control, speech ability, and personality, gone in the time it takes to brew a cup of coffee. 20 years ago, when someone came into the ER with stroke symptoms, we had very little we could offer. If there was no bleeding on the scan, we gave aspirin. Then we waited. We hoped. But often it was too late. Today, that has changed dramatically. We now have life-saving tools, powerful clot-dissolving medications like TPA, and advanced procedures that can physically remove the clot through a catheter, restoring blood flow to the brain. I've personally seen patients who arrived unable to speak, unable to move one side of their body, people who looked like they'd never walk again. And within an hour of treatment, they were talking, smiling, squeezing my hand. It feels like a miracle. But it's not magic. It's medicine. It's science. And most importantly, it's speed. Because the same treatments that work wonders in the first hour lose their power with every passing minute. After 3 hours, the window narrows. After 4.5, options start closing fast. So here's the simple truth. The faster you recognize a stroke and get help, the better the outcome. This is why you cannot wait. Don't go lie down. Don't tell yourself it's just stress. If you or someone near you is showing signs of a stroke, get to the hospital, because time lost is brain lost. Let's talk about what to actually look for, because strokes don't always announce themselves loudly. Sometimes they show up in subtle, confusing ways. That's why you need a simple, powerful tool to help you recognize the signs in real time. We call it Be Fast. It's an acronym, 6 letters that could save your life or the life of someone you love. Let me walk you through it. B is for balance. Is the person suddenly unsteady? Are they swaying, stumbling, or unable to stand straight? A sudden loss of balance or coordination is a red flag. E is for eyes. Have they lost vision in one or both eyes? Is their sight blurry, doubled, or darkened? Sudden trouble with vision, especially if it comes on fast, can signal a stroke. F is for face. Ask them to smile. Look carefully. Does one side droop? Is it uneven? If one side of the face seems slack, that's a major warning sign. A is for arms. Ask them to lift both arms. Can they raise them equally? Or does one arm drift down or feel weak or numb? Loss of strength or control in one arm is often a stroke symptom. S is for speech. Ask them to repeat a simple phrase like, "The sky is blue." Are they slurring, struggling to form words? Do they seem confused or unable to understand? If so, that's serious. T is for time. This is where it all comes together. If you see any of these signs, don't hesitate. Don't wait to see if it gets better. Call 911 immediately. Time is not just critical, it's everything. The faster emergency care begins, the more brain function can be saved. So remember, be fast. Because the truth is, strokes often look ordinary at first. A stumble, a mumbled word, a crooked smile. But behind those signs, something deadly is happening. And if you're the one who recognizes it, you can make all the difference. Not all strokes are the same. And understanding the different types can help you grasp why quick treatment matters so much and why some symptoms may appear and disappear in unpredictable ways. There are two main types of stroke, ischemic and hemorrhagic. Ischemic stroke is by far the most common, accounting for about 85% of all strokes. It happens when a blood vessel in the brain is blocked, usually by a clot. That clot might form right in the brain, or it might break off from another part of the body, like the heart or the carotid arteries in your neck, and travel up to the brain. And imagine a pipe that delivers water to your garden. Now imagine that pipe is clogged by debris. The plants downstream start to wilt and die. That's what happens in an ischemic stroke. Only it's not plants, it's brain cells. Hemorrhagic stroke, on the other hand, is caused by bleeding in the brain. This happens when a blood vessel ruptures, often due to uncontrolled high blood pressure or a condition called an aneurysm. An aneurysm is like a balloon on the side of a blood vessel. Over time, with pressure, it stretches, thins, and, if not caught in time, it bursts. When it bursts, blood pours into the brain tissue, damaging cells and increasing pressure inside the skull. Both types are medical emergencies. But there's a third condition you need to know about, something called a TIA, or transient ischemic attack. A TIA is often called a mini stroke, and that name can be dangerously misleading. Yes, the symptoms go away on their own, usually within minutes or hours. Yes, there may be no damage visible on scans. But don't be fooled. A TIA is a giant red flag. It's the body's way of saying, something is wrong. Fix it before it's too late. Think of a TIA like sparks in the kitchen. You might blow them out today, but if you ignore the wiring, the fire's coming tomorrow. You might be wondering, why do stroke symptoms vary so much from one person to another? Why does one person lose their speech while another feels dizzy and someone else has a numb arm or blurred vision? The answer lies in the incredible complexity of the human brain. Your brain isn't just one lump of tissue, it's a map, divided into regions, each with a specific job. One part handles language, another manages memory, one controls movement, another governs balance or vision. So when a stroke cuts off blood flow to a particular area, it disables whatever function that area controls. For example, the left side of the brain is where speech and language live for most people. So if a stroke hits the left hemisphere, the person might struggle to talk, find words, or even understand what's being said. At the same time, The left brain also controls the right side of the body, so right arm or leg weakness often appears too. On the flip side, a stroke in the right hemisphere may not affect speech at all, but it can impair attention, memory, judgment, or cause weakness on the left side of the body. If the stroke affects the cerebellum, the part of the brain responsible for coordination and balance, you might see sudden dizziness, trouble walking, or a loss of motor control. And then there's the brainstem, which controls vital functions like breathing, heartbeat, and consciousness. A stroke there can be catastrophic, even if the symptoms at first seem minor. So remember, stroke symptoms depend entirely on where the damage is happening. That's why you must take every unusual sign seriously, because behind a strange smile or a spinning room might be a blocked artery, and every second counts. There's a myth we need to break, and fast. Many people still believe strokes only happen to the elderly, but the data tells a very different story. In the last decade alone, stroke rates have risen by nearly 15% in adults aged 18 to 44 in the United States. Globally, nearly 1 in 7 strokes now occurs in people under 50. This isn't just a blip. It's a clear, dangerous trend. So why is this happening? Why are younger people, people in their prime, suddenly at greater risk? One reason is that the risk factors once limited to older adults are now showing up earlier. Conditions like high blood pressure, type 2 diabetes, high cholesterol, and obesity are becoming increasingly common in people in their 20s, 30s, and 40s. It's easy to see how sedentary lifestyles, fast food, chronic stress, sleepless nights, it adds up. And while the outward signs may seem small, tiredness, weight gain, skipped checkups, the internal damage is building. But there's more to the story. In younger people, strokes aren't always caused by clogged arteries. They can be triggered by unusual or non-traditional factors, things like autoimmune disorders, blood clotting problems, migraines, or even certain types of birth control. In women under 45, one study found that up to 35% of strokes were linked to migraines. In men, the number was around 20%. That's not something most people think about when they feel head pain. And here's the most dangerous part. Because younger people don't believe they're at risk, they often ignore the signs. They wait. They assume it's exhaustion or dehydration or stress. But by the time they realize it's serious, it's too late. We've also seen an increase in strokes related to undiagnosed heart conditions like atrial fibrillation or untreated hypertension that's been silently damaging blood vessels for years. So what does this mean for you or your family? It means stroke prevention isn't just for seniors anymore. It means we need to talk to our kids, our spouses, and our friends about blood pressure, about diabetes, about staying active, and knowing the warning signs. Because stroke doesn't care how old you are. And the best way to fight back is to be ready before it strikes. Now that you understand how stroke strikes, how fast, how silent, how devastating, the next question is, what can you do about it? The good news is, a large portion of strokes are preventable, and it starts with taking control of the risk factors that put you in harm's way. First and foremost, manage your blood pressure. High blood pressure is the single biggest driver of both ischemic and hemorrhagic strokes. Think of it like a silent wrecking ball, weakening blood vessels over time until one finally bursts or clogs. If your blood pressure is high, don't wait. Work with your doctor, monitor it, adjust your diet, take the medications you're prescribed. It matters. Second, control your blood sugar. Diabetes doesn't just affect your pancreas, it damages your blood vessels from the inside out. It increases inflammation and makes clots more likely. Keeping your glucose in check protects your brain, not just your heart. Third, get your cholesterol under control. High LDL, bad cholesterol, can lead to the buildup of fatty plaques in the arteries, which can rupture and cause clots. And then there's smoking. If you smoke, you've doubled your risk of stroke. That's right, doubled. But the good news is, the moment you quit, your body begins to repair itself. After just 5 years, your risk drops nearly to that of someone who never smoked. Exercise, just 30 minutes of walking a day can improve circulation, reduce weight, lower blood pressure, and stabilize blood sugar. You don't have to run marathons. You just have to move, eat well, focus on vegetables, fruits, whole grains, lean protein, and healthy fats. Cut back on sodium and ultra-processed food. Food is medicine or poison. You choose. And here's something you may not have heard. Researchers have now identified a metabolic index called TIGWWI that can help predict stroke risk even in people who seem outwardly healthy. It combines triglycerides, glucose, weight, and waist measurements. If your numbers are high, your risk climbs significantly. So even if you feel fine, it's worth getting tested. Finally, don't skip your checkups. That yearly doctor visit may feel unnecessary until it saves your life. Prevention is not just about avoiding disease. It's about protecting your future, your memory, your independence, your time with family. And when it comes to stroke, the steps you take today can change everything about tomorrow. If you've made it this far, then you already know more than most people do about stroke. But knowledge means nothing if it stays locked inside your head. So let me ask you, who do you care about that needs to hear this? Your spouse? Your daughter? A friend who's always tired but won't see a doctor? Someone in your family who had a funny moment last week and brushed it off? Send them this video right now, because one day it might not be you who spots the symptoms. It might be them standing over you, wondering what to do. And if they've seen this, if they've learned what you now know, they'll be ready. Stroke steals lives, but awareness saves them. So please, share this, leave a comment, and take this message forward. Together we can stop strokes before they start.